There's mounting evidence that women worldwide are disadvantaged when it comes to healthcare. This includes a lack of access to medical treatment or having their legitimate concerns and decisions about their own health dismissed by doctors and other medical workers. Even the field of medical research often has a male bias, and the consequences can be deadly. In India, studies show that many women don't get equal access to healthcare because of reasons related to their gender. Doctors say that there are economic and cultural factors at work, and often it's women from poorer communities who struggle with these issues the most. Ghazala Sheikh has been suffering migraines for the past few years that have only worsened over time. She knows she needs medical attention, but with 3 young children to look after, while her husband goes out each day to work, it's hard to get an opportunity to seek help.
ना दर्द होने के बाद भी घर में काम करना पड़ता है। इतनी परेशानी होती है कि मतलब सर में सोचते हैं कि थोड़ा देर लेट जाओ तो फिर लेट नहीं सकते, हम लोग आराम नहीं कर सकते, इतना सर में दर्द होता है और दर्द होएगा ना कंटिन्यू 1 हफ्ते तक ऐसा दर्द होते ही रहता है।
She did report the problem to a government hospital after the birth of her second child 4 years ago. Doctors there said she should go for a costly scan at a larger facility. Because of the expense and the demands of the household, she never went for it. Her husband, Shanawaz, earns about 15,000 rupees, or around $180 a month as a tailor, and it's tough to make ends meet.
मैं दिन भर वाइफ उसको मैनेज करना, बच्चों को स्कूल भेजना, फिर मेरे लिए खाना बनाना, और उनकी तबीयत भी ख़राब होती तो बार-बार मैं हॉस्पिटल नहीं लेके जा सकता हूँ, बार-बार उन्हें डॉक्टर के पास नहीं लेके जा सकता क्योंकि सैलरी के हिसाब से इतना मैनेज करना बहुत डिफ़िकल्ट हो जाता है मेरे लिए।
Ghazala is not alone when it comes to not seeking medical care. Research shows that she's part of a broader trend of a clear gender bias when it comes to healthcare. A study by Harvard University and experts from India looked at the records of more than 2 million outpatients who visited the All India Institute of Medical Sciences, or AIIMS Hospital in New Delhi, between January and December 2016. They found that the number of male patients was nearly double that of women. For every woman that visited the facility, there were 1.69 male patients that went in. At this clinic in Mumbai, doctors say females have a harder time accessing healthcare in India for reasons that are deeply rooted in the country's culture.
Culturally, traditionally, women are given a secondary position, and that's across several things. It's not just healthcare, wherever it is, it's always been a secondary position. Because we are a society which is a patriarchal society, and yes, it's changing, but it's going to take probably another generation or 2 to really see a massive change.
Dr. Galada explains that many women in India aren't financially independent, which holds them back from making their own decisions about medical treatment. Although there are free government hospitals in India, many people opt for private treatment because of waiting times and quality of healthcare, according to the National Family Health Survey. And there are other hurdles.
Women will usually be accompanied by a male, be it a brother, a husband, father. It's not often that women will walk into clinic alone. So the man needs to be free to take her to the doctor. And we lose on to a lot of access to healthcare there itself, is because either certain problems are ignored or postponed.
It's not only the poor in India who are put off going to the doctor. Housewife Reena Dave says she's been experiencing back pain and some heart pains, but she's avoiding a checkup. Her family has private health insurance, but she says several treatments aren't covered.
थोड़े दिनों में हार्ट में दर्द होता रहता है मुझे, मामूली सा होता है, इसलिए मैं अवॉइड कर रही हूँ। और पोजीशन हमारे अभी ऐसी है कंडीशन की डॉक्टर के पास नहीं जा सकती मैं।
Oncologist Dr. Ashay Karpe says that women not coming forward for tests and treatment can be deadly. He's noticed that cancers are often detected in women at a much later stage of the disease compared to men. He says many deaths could have been prevented if they'd had access to screening programs or sought help sooner.
They are having a problem, but they have not told anybody, and especially, somehow because of some social stigma, and there's nobody to talk to. Basically, when it comes to reproductive organs, they are all the more shy to discuss it with somebody till they reach a point of break.
The problem is worse in rural India, where women tend to have lower levels of education and less economic freedom. And while most of the population live in rural areas, there are fewer medical facilities to serve them. Medical experts say a shortage of doctors only exacerbates the problem. The World Health Organization says India's doctor-to-patient ratio fell to 0.7 per 1,000 people in 2020 as the country's population increased. That falls short of the agency's recommendation of at least one doctor per 1,000 people. Steps are being taken to improve the situation. India's health sector budget was increased by 13% for the current financial year over the previous year. And many organisations are helping to boost women's access to healthcare. The NGO SNEA works on improving health equity among the urban poor, with a focus on women and children. Its volunteers visit women in slum areas to educate them about nutrition and health.
And we feel there's a need now to start.
Its CEO, Vanessa D'Souza, believes that if India can achieve universal health coverage, this would go a long way to addressing some of the problems.
The other thing that we can certainly bring focus on is, number one, strengthening the current public health facilities, increasing the availability of services, so having mainly focus on primary health.
Doctors say access to healthcare is gradually improving for women, particularly in India's large cities, where more females are becoming financially independent. But for all too many women like Ghazala, even the most basic medical attention remains dangerously out of reach.
Women's health has historically been overlooked in the field of medical research. In the UK, researchers are not required to consider the different experiences of men and women when testing treatments and medications. The results have a direct impact on how doctors treat their patients. Gender is also underrepresented when it comes to research funding. Only a fraction of public grants is allocated towards reproductive health. That leaves many women waiting years for diagnosis and even longer for treatment.
Pain isn't always visible, but it hangs over the day-to-day life of Bethany Dufton. She suffers from endometriosis, where tissue similar to the lining of the womb ends up in other parts of the body. It took 7 years to reach a diagnosis, which almost always requires surgery.
Every day I'm in pain, basically, in one way or another. But then sometimes I'll just kind of be in bed all the time as well, and not really be able to function other than to kind of do self-care, basically. So it varies, and I think that's kind of a part of the problem of the condition as well, because some of the time I'll be up and about and looking fairly normal to people, and I think then it's hard for people to understand why it has such a huge impact on your life.
Endometriosis is as prevalent in women as diabetes. It affects 1 in 10 women, nearly 200 million worldwide. But there is relatively little research into how to diagnose and treat it. Dufton has participated in several clinical trials, including the surgery that led to her diagnosis.
Surgery has been the mainstay of treatment for many years, but interestingly, there hasn't been the studies of why it works, how it works, and whom it works. It's sort of just kind of crept into practice.
Other less invasive treatments are being investigated. Researchers at the University of Edinburgh are carrying out several trials into endometriosis, but funding has proven to be a challenge.
Women's health issues are often overlooked by funding bodies, or at least they have been in the past. And endometriosis, I think, particularly suffers from the sort of menstrual stigma around it, the fact that it's a pain condition, it's a hidden condition.
In the UK, most medical research is financed by pharmaceutical companies and government bodies. Conditions like endometriosis are competing for their attention against hundreds of other illnesses. When their applications are turned down, scientists often turn to charities. Unlike high-profile diseases like cancer and diabetes, there aren't many charities dedicated to women's health. Those that do exist have relatively limited resources for research.
We might only fund 1.5 million a year in new research grants, whereas other charities, fund 10, 20 million, maybe even up to 100 million plus if it's someone like Cancer Research UK. So it is a really small pot, and we need to raise more funds to fund this.
Excluding cancer, only 2.1% of publicly funded research is dedicated to women's reproductive health and childbirth. And charities which rely on donations struggle to get enough attention for women's health causes.
It isn't just reproductive health that is under-researched. Clinical trials often fail to account for women's experience of other health problems too. For many illnesses, data about women simply doesn't exist.
Cardiovascular health is one of the best funded areas of medical research, but it's also where the discrepancies in outcomes between men and women are most apparent. Jill McLagan was 50 years old, fit and otherwise healthy when she had 2 heart attacks. She didn't recognize her symptoms, and neither did doctors in the emergency room.
I was then given a diagnosis of gastritis, like an upset tummy. But thankfully they had done a blood test, and as I was putting my coat on, getting ready to go back outside, the senior A&E doctor came back in and said, "I'm really sorry, you've definitely had 1 if not 2 heart attacks. You're not going anywhere."
Her condition turned out to be caused by SCAD, spontaneous coronary artery dissection. It almost exclusively affects women, usually those experiencing hormonal changes like menopause or a recent pregnancy. The symptoms differ from a normal heart attack, and they often go undetected because patients don't fit the typical profile. Research funded by the British Heart Foundation found that more than 8,000 women in the UK died over the course of 11 years because their heart attacks were diagnosed too late.
Their diagnostic journey is much harder than it is for men. So we know that when women present with chest pain, they're more likely to be told that they're anxious, be dismissed because it couldn't possibly be a cardiac event.
That treatment is informed by decades of research which has focused on the male experience.
It was customary when we're doing cell biology to look at male animals because they don't have these pesky hormones that affect their metabolic cycles and so on. So we really, right back to the very beginning of the journey in research, have neglected women. Then when we recruit women to clinical trials, we're much less likely to be able to recruit them. And then subsequently, they're less likely to receive accurate treatment.
Unlike in the US, Canada and the European Union, there is no requirement in the UK to break down clinical trial data by gender. Campaigners say that means women are more likely to receive care that isn't based on evidence. They're now working with funding bodies to create new guidelines.
We don't know necessarily about the symptoms that women experience with particular diseases. We don't know about the treatments that are going to be effective, the dosing of medicines, and the likely side effects that they might experience. We believe very strongly at Message that that bias can be stopped first and foremost in research, getting the research right, and then that will filter through into clinical care.
For women suffering from health issues, more data is needed as soon as possible.
I think that there are huge health inequalities in the UK still, unfortunately. And I think as well endometriosis, as I said before, is quite a kind of a hidden condition in some ways. So you may know a lot of people who have it and you don't even know they have it.
Awareness is growing, but medical research takes many years. In the meantime, women are left waiting for treatment tailored to their bodies.
Stories of violence against women have become all too commonplace. But one area that's less well documented is the abuse that some women face at the hands of doctors and other medical workers during pregnancy and birth. This can range from feeling pressured into a procedure all the way to being violently harmed. 1 in 5 women say that they were mistreated during maternity care, according to a recent study from the US Centers for Disease Control and Prevention. I'm here in California, where I've been speaking to patients and doctors who've told me that this problem is widespread in the US healthcare system. A warning that some of the images in my report may be upsetting.
Pass it to me really quick.
An after-school kick-around is a far cry from the trauma of Rio's entry into the world. His mother, Kimberly Turbin, was left severely injured and traumatised by a procedure administered against her will by the doctor delivering him.
He walks in with scissors in his hand and says that he's going to do an episiotomy. I said, why? We haven't even tried. He said, why? Because I am the expert here. That's why. I said, okay. So then he comes towards me with scissors again, and I say, no, 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 don't cut me.
Kimberly's sister and mother were filming the birth, so the whole incident is caught on camera.
Okay, yeah. What can I do? You can go home, do it. Don't go to Kentucky.
He never told me that there was an emergency. The nurses never told me there was something wrong. I had all the monitors on. There was no alerts anywhere. So to me, I was just like, well, why? It was a natural reaction for me to ask why. And I wasn't necessarily like contesting him. I was just curious as why did I need to be cut if I just got here?
That moment when you've just given birth to your first child is like no other, but how was it for you?
I wouldn't know, because he took it away from me. I didn't know the feeling of happiness. I completely shut down. He completely took the whole moment away from me. I couldn't even speak after.
The experience gave her lifelong injuries, extreme pain and PTSD, and she struggles to afford the ongoing treatment she needs.
I can work out a little bit here and there if I do pelvic floor therapy. Pelvic floor therapy with insurance still cost me around $6,500 in 1 year. Yeah, so it's really expensive to treat the conditions that Dr. Abazi left me with.
The United Nations has recognized obstetric violence as a violation of human rights, but the term is subjective and research on the topic is still scarce. Kimberly's story is harrowing, but thankfully those types of extreme cases are relatively rare. But I'm on my way to meet a woman who suffered a much more subtle but more common form of prejudice. When she fell pregnant with her first child, Diana Hinken knew that she wanted her labour to be as natural as possible.
We got to the hospital, and I remember the first thing the midwife said to me was, if you don't progress in the next hour, I'm gonna give you morphine. And to me, it was such a shock to arrive. It feels so unwelcome.
She went on to have a cesarean section.
So everything you didn't want? Everything I did not want. Every single thing on the menu I did not want, I got.
What effect did it then have on you afterwards?
I remember that when I got home, I just felt so empty. I just felt clueless. I loved this beautiful baby. She was so beautiful and she was perfect. She was healthy. She started breastfeeding right away. My body started healing really well. We could go on walks, but mentally, I just was a disaster. The only thing that really made me feel good was to see my doula. I'm gonna cry. It's been 15 years.
More than a third of women have experienced mistreatment around the time of childbirth, according to a WHO multi-country study published in 2019. Younger, less educated women were most at risk. But Dr. Emiliano Chavira says that many of his colleagues don't believe there's a problem.
One concept that was expressed to me once by another OB in our department is, I understand, Dr. Chavira, you think you're explaining risks of things to the patient, but sometimes people don't really understand what they're getting into and the decisions they're making. And, for me, that comes down to it's misogyny in the sense that you are saying that women do not really have the capacity to understand information and make a decision of their own.
He says there are few incentives for practitioners to change the way they behave.
The forces that create this reality are very, very powerful, and they're economic, and they're medical legal, and they're many other things. You don't really get rewarded for the education. You don't get compensated for the time that you spend teaching people, telling them what their options are. When I have conversations about autonomy and ethics with my colleagues, they're bored. Their eyes glaze over. This is not interesting to them. It's just hard for me to imagine some kind of real organic change that bubbles up from within obstetrics.
Maternal health advocate Dawn Thompson says that's why educating women is vital.
We've got to keep, I started a TikTok channel and I'm at, over nearly 40,000 followers at this point, and doing videos every day and just trying to talk about it, because that's how we do it. Just keep talking and keep talking and keep talking until we reach enough people that the system says, the system has no motivation right now to change. It's working just fine for the system. The system, and there's some people who would say the system's not broken, it was built this way, right? But it's just gonna take enough people to just keep pushing the ball uphill until we get to the top and it goes over.
That's also Kimberly Turbin's goal. 10 years on, she's focused on the joys of motherhood, not the pain, and on trying to make sure that other women don't have to go through the same trauma that she did.